Hello, friends. Welcome to this session of quick revision of the INI-CET Biochemistry recall questions. As I mentioned in the previous videos, what we're doing is the recall of the previous year's INI-CET question, just looking at the question, the options, and the correct answer. We are not going into the details. Why? Because we've already shortlisted the 60 common, and in addition to that, 12 less common topics which have been asked over the last 10 papers, which we'll discuss in detail one by one separately. We will have separate videos for each of the topics and questions which have been asked in the previous INI-CET. Here we are just doing the recall question, the options, and the correct answer so that you can use it for the rapid revision of the previous year's question, not the topic per se. Topics we will discuss separately because it will take a little bit more time. Okay. So without spending much more time, let's go on to the questions. My first question: a young boy presents to the OPD with enlarged muscles with strong orangish yellow discoloration. You can see it as seen in image below. Testing revealed reduced level of HDL and ABCA1 mutation. What is the likely diagnosis? Your options are A beta lipoproteinemia, Wolman's disease, Tanger's disease, and the Gaucher's disease. So in this case, the correct answer is the Tanger's disease. Tanger's disease is characterized by the mutation in ABCA1, the characteristic, the orangish yellow discoloration of the tonsils, and the reduced levels of HDL. We'll talk about the different hyper and hypolipoproteinemias separately in one video where we'll talk about all these disorders. Please note that in this particular exam, we had two sessions, both morning and afternoon. Both the session questions have been clubbed together into one single set. Okay, moving on to next question. Refsum's disease is caused by the defect of, your options are beta oxidation of branch-chain fatty acid in peroxisome, alpha oxidation of branch-chain fatty acid in peroxisome, the alpha oxidation of branch-chain fatty acid in lysosome, and beta oxidation of branch-chain fatty acid in the mitochondria. Now, I'm sure most of you know that Refsum disease is related to defect in alpha oxidation of branch-chain fatty acid in the peroxisome. The culprit is peroxisome. Metabolism which is affected is that of the branch chain fatty acid. Branch chain fatty acid meaning phytanic acid. They undergo alpha oxidation. So this is the correct answer. We'll talk about the different types of oxidation again in a separate video. Moving on, a baby is brought with the complaints of bleeding neurological symptoms. During examination, it is noted that the urine had a smell of burnt sugar. Some of the disorders give very characteristic urinary odor. This disease occurs due to deficiency of which of the following enzymes? Your options are phenylalanine hydroxylase, fumarate acid hydrolase, isovalerial coenzyme A dehydrogenase, and branch chain keto acid dehydrogenase. So I'll quickly highlight the answer here, which is the branch chain keto acid dehydrogenase. We're dealing with the maple syrup urine disease, right? This is the maple syrup urine disease where the defect is in the metabolism of branch chain keto acid. So they start accumulating, and the burnt sugar odor or the caramelized sugar odor or the maple syrup like odor in the urine is the characteristic feature. Next question. A baby is being evaluated for delayed developmental milestone. On examination, the child has hepatosplenomegaly. Now, hepatosplenomegaly is one of the very important findings in clinical examination. It can be seen in a lot of cases. Microscopy of bone marrow evaluation is shown below. What is the diagnosis? Your options are Gaucher disease, Niemann-Pick disease, the Hunter's disease, and the Hurler disease. Now, this image which is shown here is showing a cell which is described as crumpled or wrinkled tissue paper. This crumpled or wrinkled tissue paper appearance is that for a Gaucher cell. Gaucher cell can be seen in CML and it can be seen in the Gaucher's disease. So the option given here is the Gaucher's disease. In CML, you have the pseudo Gaucher cell. In Gaucher's disease, you have the Gaucher cell. Both have similar appearance. So it is not a confirmatory finding, but it is a very strong indicator for the presence of the Gaucher disease. The hepatosplenomegaly and the delayed developmental milestone will favor the Gauchers rather than the CML. In CML, you don't have any effect on the developmental milestone, hepatosplenomegaly may still be there. Glycogen phosphorylase is activated, another two question, directly or indirectly by. See, there are two components here, directly or indirectly by. The options are calcium, glucose 6 phosphate, protein phosphatase, cyclic AMP dependent protein kinase. So, what you have to remember here that the cyclic AMP dependent protein kinase will only activate the glycogen phosphorylase directly. The B and C are inactivators. Both direct and indirect activation is done only by calcium. Calcium can bind itself or it can bind to the calmodulin and it can act indirectly also. So glycogen phosphorylase is activated both directly and indirectly by calcium. We'll talk about the details of glycogen metabolism separately. We also have to discuss the glycogen storage disorders there. So we have a separate video talking about the glycogen synthesis, breakdown, and the glycogen storage disorders. The significance of HMP shunt are all except it is a source of NADPH, source of ribose 5-phosphate, source of acetyl coenzyme, it utilizes ribose. So obviously it is not a source of acetyl coenzyme A, right? So the source of NADPH is very important. Source of ribose 5-phosphate, very important. These are the two for which the HMP shunt is well known. However, it can also make use of the ribose to generate the ribose 5-phosphate. Although in the pathway you may not see this, so this is uh, means a gray zone. However, still the best possible answer is acetyl coenzyme as a source. Moving to next question, elderly patient presents with elevated homocysteine level and normal methyl malic acid levels. Megaloblastic anemia is seen on peripheral smear. Hemoglobin is 7 gram%, MCV is 90 milliliter. What deficiency is most likely caused? Your options are folate deficiency, vitamin B12 deficiency, biotin, and vitamin B2. Please note, elevated homocysteine levels can be both benign and B12 deficiency, but at the same time, normal methyl malonic acid level rules out the B12 deficiency. So you're left with the folate. So here the correct answer is folate deficiency, because if it were the B12 deficiency, then methyl malonic acid levels will be elevated. Methyl malonic acid cannot be metabolized to the succinyl coenzyme in absence of the vitamin B12. There we get the methyl malonic aciduria, because methyl malonic acid levels are quite high. Which of the following tissues are dependent on insulin for glucose uptake? Your options are pancreas, brain, muscle, adipose tissue. You have to remember only two set of tissues which are dependent on insulin for glucose uptake in excess. These two are adipocytes and muscles, both cardiac and the skeletal muscle. So your correct answer should include only 3 and 4, which is option number C. Okay. So we'll talk about the glucose transporters. We have a very nice table where we talk about all the different glucose transporters, the clinical aspects, the tissues which are involved, etc. in a separate video. Consider the following enzymes: glutathione reductase, glutathione peroxidase, deiodinase, and the thioredoxin reductase. Which of them contains selenocysteine? Your options are A, that is 134, B, which is 234, C, which is 123, D, which is 124. Please note, selenocysteine is the 21st amino acid because it is also inserted during the translation. So we have a separate video discussing about the selenocysteine. This question has been asked frequently. What you have to remember here that the selenocysteine is present in glutathione peroxidase, it is present in the 5-deiodinase, it is present in the thyroidoxine reductase, it is present in the glucose 6-phosphate dehydrogenase. So a lot of enzymes where the cholecysteine is present. In this given list, your answer should include 2, 3, and 4, which is option number B. Moving on to next question, which of the following is true? To break AT bonds, high TM is required. To break GC bonds, low TM is required. To break AT bonds, low TM is required. AT bonds and GC bonds need the same TM. Now, what you have to remember here, between A and T, you have only two hydrogen bonds. So breaking them is simpler in comparison to the G and C, where you tend to have three hydrogen bonds, so breaking them is more difficult. So the correct answer here is that to break 80 bonds, low melting temperature is required. TM stands for melting temperatures. Correct answer is to break 80 bonds, low TM is required. To break GC bonds, you would actually require higher TM. So this is really not correct. Here you require low TM, and this is also not correct. Okay. Cystic fibrosis is caused by which of the following deletion? Now, this question has been repeated back to back twice, so it has high chance of getting repeated again. Here the options are tyrosine at 508, phenylalanine at 508, tryptophan at 805, tyrosine at 805. Please note the answer here is phenylalanine. Mutation is described as delta 508 in the CFTR gene, which results in the loss of the phenylalanine at position 508 in the protein chain. Long-term glycemic control in a person with hemolysis is assessed by estimating fructosamine. Fructosamine is an glucosaminoglycan urea. Fructose a protein. What you have to remember here that fructosamine is actually glycated albumin. It is the glycated albumin. So your answer here has to be protein. Albumin is a protein and fructosamine is used where the half-life of the RBC is lower. So in that case, the HA1C doesn't give the true picture of the glycation. So we need something with a shorter half-life than an RBC to get a true picture of the glucose levels in the previous few days or the weeks. SARS-CoV-2 diagnosis done by all of the following except your options are the RT-PCR, real-time PCR, southern blotting, and immunoassay. What you have to remember is that southern blotting will specifically identify the DNA in the SARS-CoV-2 virus. You only have the RNA. It must first be converted into the cDNA before you can identify. So southern blotting alone cannot be used. Okay. So SARS-CoV-2 diagnosis cannot be done by southern blotting. RT-PCR, the real-time PCR, immunoassays, these are valid components in the SARS-CoV-2 diagnosis. 2,3-BPG causes unloading of oxygen to tissues because your options are it decreases ATP production and hence breaks the link between the globin chains. It increases ATP production, binds to the central cavity of hemoglobin surrounded by histidine and lysine and favors salt bridge formation. It inhibits the taut structure formation. Please note only option C is correct. It binds to the central cavity of hemoglobin surrounded by histidine and lysine. Thereby, it favors the formation of salt bridge, which stabilizes the taut structure, and the taut structure will result in the unloading of the oxygen. Which tragedy is related to which of the following alcohols? Your options are methyl alcohol, ethylene glycol, and the hypoglycine. So please note that the Hooch tragedy is a result of adulterated alcohol due to poor distillation, and the answer here is methyl alcohol. It may also be due to contamination because methyl alcohol is supposed to be thrown away in distillation, but to save money when the demand is high during festivals, that is when the adulteration can also take place. And very commonly we hear stories, horror stories in the paper, which is due to the spiking of the normal ethyl alcohol with methyl alcohol results in blindness, and if untreated, it will cause the death. So this is known as the huge tragedy. We will have a separate video on methanol metabolism because in one of the other exams, they have asked about the metabolites of the methanol. Okay, so we'll take a look at methanol metabolism separately. Now, this question has been asked in different forms quite frequently. Identify the left curve. Left curve means this. Given the curve is of, sorry, left curve is this. Given that the curve given is the adult hemoglobin. So you have to identify this. Although I've written in the image already, that is myoglobin. Your options would have been myoglobin, fetal hemoglobin, carbon monoxide poisoning, and acidosis. Please remember that in case of adult hemoglobin, it is able to bind with the 2,3-BPG, and it shifts towards the right. Myoglobin does not bind to the 2,3-PG, therefore, it has a different curve. If there were no 2,3-PPG, the curve for the hemoglobin would also have been similar. Okay, so we'll talk about the hemoglobin, the mechanism of action, how it is binding, how it is unloading, the oxygen, etc. in a separate video. Here, your answer is myoglobin. The graph on the left is myoglobin. Okay, now assertion reason question. Assertion is phenylketonuria is characterized by the mousy odor. The reason given is tyrosine and norepinephrine are not formed in PKU. Your options are both assertion and reason are true, and reason is the correct explanation for assertion. Both assertion and reason are true, and reason is not the correct explanation for assertion. Assertion is true, but reason is false. Assertion false, but reason is true. Please note here that PKU is characterized by mouse odor. Correct. Tyrosine and norepinephrine are not formed in PKU. Correct. However, this is not the cause for PKU or even for the mousy odor. Okay. So the mousy odor is due to the phenyl acetate coming out in the urine, which is the alternate metabolite for phenylalanine, and it is not related to the tyrosine and norepinephrine. Meaning, both assertion and reason are true, but the reason is not the correct explanation for the assertion. So this is the answer here. Next question, Zellweger syndrome is caused by the defect of which of the following organelles? You have mitochondria, lysosome, peroxisome, and nucleus. I'm sure if you know the answer is peroxisome. Zellweger syndrome, and previously we did the Refsum's disease. So Refsum's was asked in the morning session, the Zellweger was asked in the afternoon session. These two questions are asked very frequently. We'll talk about these two conditions when we are doing the videos. Okay, one new important topic likely to be repeated again. So please be very, very careful about this. We'll have a separate discussion on the sirtuins. All are true about sirtuins except increases insulin sensitivity and supports glucose metabolism. Yes, be correct. It is a histone deacetylase and it causes chromatin condensation. Again, appears to be correct. It increases the lifespan. Very correct. That is why it is a favorite of the examiners. It is stimulated by niacinamide is not correct. It is stimulated by the nicotinamide adenine dinucleotide, not by the niacinamide. So the answer here is option D. This is not true about the sirtuins. We'll talk about sirtuins separately. Very, very important new topic, very likely to be repeated frequently. True about the action of enhancers of gene expression. Include transcription factors and modify regulatory mechanisms appears to be correct. Only when present in close connection with promoter region they are able to act. This is not correct. Only when present in upstream of promoter region, again not correct. Very specific to one gene, not necessary. So here the answer for you becomes A. A is about action of enhancers of gene expression. We'll talk about the regulation of gene expression separately, where we'll also cover the action of the enhancers. Papers generally have this graph in one form or the another. Identify the type of enzyme inhibition shown in the graph. Your options are competitive, uncompetitive, non-competitive, and suicidal along with this graph. What you have to note in this graph that the uninhibited reaction and the inhibited reaction have the same Km. They share the x-intercept point, which indicates or represents the -1 upon km. Meaning, if -1 upon km is same, then the km will also be the same. Km is same by definition in non-competitive enzyme inhibition among the mixed group, right? So here the answer is the non-competitive inhibition. Competitive inhibition, we will discuss later that the graph should have been passing through the y-intercept. Okay, in that case, it would have been a competitive inhibition where the Vmax does not change. So the last question in the series, an iron gap is seen in which type of acid-base disorder? Your options are respiratory acidosis, respiratory alkalosis, metabolic acidosis, and the metabolic alkalosis. So I'm sure all of you know that metabolic acidosis with anion gap is a very, very important entity. You have two conditions, metabolic acidosis with increased anion gap, metabolic acidosis with normal anion gap. Okay, metabolic acidosis with increased anion gap and metabolic acidosis with normal anion gap. Okay, so this is all about the questions from the INI-CET November 2022. Thank you very much, and please keep watching.